next topic is discussing some arterial supply to the upper limb. First, some overview, and then we can move on the details. You see, this is the right-sided upper limb showing the artery supplying there is in fact coming from the neck region. In the neck region, it was under the clavicle, so it is called as a subclavian artery, but then it will cross outer border of the first rib to enter the axilla and become axillary artery, and then after crossing lower border of the teres major, it will enter the arm to become brachial artery. So we have to understand that it is called as subclavian artery under the clavicle in the neck region. And when it is passing the outer border of the first rib, here is the first rib attaching. So as it is crossing the outer border of first rib, it will enter the axilla and it is called axillary artery. This axillary artery crossing the lower border of teres major, enter the arm, and then it is called as the brachial artery. So axillary artery continues as the brachial artery, and also remember 6 branches from the axillary artery. Actually, the first part of the axillary artery will give us 1 branch. Second part of the axillary artery will give us 2 branches, and the third part of the axillary artery will be giving us 3 branches. So total, you'll find that there are 6 branches. So we are telling there are 3 parts of axillary artery and 6 branches that we have to discuss in detail. As you focus upon the lower part of the artery of the upper limb, you will see this brachial artery, which we have seen in the brachium or the arm region. It is coming down and then it will become a content of the cubital fossa. This brachial artery as a content of cubital fossa will divide into 2 branches. One of the branch which is going with the radius bone is called as the radial artery, and it is going to become deep palmar arch in the palm. Deep palmar arch in the palm. And if you are following the other one, which is a branch of the brachial artery in the cubital fossa, it is running with the ulnar bone, so ulnar artery become the superficial palmar arch. It will become superficial palmar arch. That is a continuation of ulnar artery in the palm. Now let us move on to the details, and you see we are drawing this diagram, but before you draw the diagram, we should have still more details, and let us do it. Then we can draw the diagram. You see here, this is one diagram which you already have seen. It is the arch of the aorta and arch of aorta giving the 3 branches. Do you remember their names? Because we have discussed them in the heart, and this is the head and neck region. So this is the 3 branches of the arch of the aorta, and the first branch is called as brachiocephalic trunk, and the second is called as the left common carotid artery. Then you have the left subclavian artery. And what is this brachiocephalic trunk doing? Brachiocephalic trunk is actually dividing into 2 branches, one to the upper limb, that is called right-sided subclavian artery, and one to the head neck region, which is called as the right-sided common carotid artery. And this right-sided subclavian artery, as you are following, which is under the clavicle in the neck region, is crossing the outer border of the first rib. But before that, it is giving us 3 branches. If you remember, the subclavian artery has 3 parts, and the first part is giving 3 branches by the mnemonic width branches. And in the width branches, what is this V going up? First branch of subclavian artery giving the width branches, the V which is going up is called as the vertebral artery. So as it will supply the circle of Willis. The I which is coming down is called as internal thoracic artery. It is also called internal mammary artery to supply the mammary gland and thorax region. And the T branch is the thyrocervical trunk. If you say T is the thyrocervical trunk, called so because supplying thyroid gland and the neck region. Now this thyrocervical trunk itself will give 3 branches, and we remember them by the name sit branches. You mean to say in the width, the T will give the sit branches. Means in the width, the T is thyrocervical trunk, and thyrocervical trunk is giving the 3 branches. So what are they? you will find that there is S branch, which is the suprascapular artery going to the scapula for scapular anastomosis. And then there is the I, which is inferior thyroid artery supplying the thyroid gland. And then there is a T branch of the T, which is called as the transverse cervical artery supplying the neck region transversely. So, transverse cervical artery is a branch of thyrocervical artery, is a branch of the first part of subclavian artery. Yes, and sometimes this transverse cervical artery is giving us dorsal scapular artery, though the dorsal scapular artery is usually a branch from the third part of subclavian artery, but dorsal scapular artery can also be given by transverse cervical artery. So transverse cervical artery can sometimes, some population, it will give us the dorsal scapular artery, which usually a branch of the directly from the third part of the subclavian artery. Now as you move further, this is the outer border of the first rib, and after crossing the outer border of the first rib, the subclavian artery will enter the axilla to become axillary artery, and then it is crossing the lower border of the, so starting from the outer border of the first rib and reaching the lower border of the teres major, that is the extent of the axillary artery, because after that it will become brachial artery in the brachium, the arm. So this is the axillary artery. Yes, it is in axilla, and it has three parts divided by a muscle which is called as pectoralis minor muscle attaching to the superior surface of the coracoid process. Pectoralis minor, yes, which is in the pectoral region. Yes, rib number 3, 4, 5 is the origin, and insertion is superior surface of the coracoid process of scapula. So it is dividing the artery into three parts. What are the three parts? Actually, proximal to the muscle, deep to the muscle, and distal to the muscle, part 1 to 3. And then you say the part 1 will give one branch, part 2 deep to the muscle will give two branches, and part 3 distal to the muscle will give three branches, so that you have total 6 branches. So pectoralis minor divide the artery into three parts. Yes, what is the first part giving? First part will give only one branch, superior thoracic artery. Remember, superior thoracic artery supply mammary gland, and it do not supply the scapular anastomosis. These are questions. So telling that superior thoracic artery is the first branch of the axillary artery. Yes, from the first part of axillary artery, and it is supplying mammary gland. Yes, and do not supply the scapular anastomosis. No. What are the two branches from the second part of the axillary artery? Two branches from the second part of the axillary artery are under cover of the scalenus anterior muscle, and they are both thoracic. One is called acromiothoracic, other is lateral thoracic, and they're supplying the mammary gland. So one is acromiothoracic and one is lateral thoracic. Yes, from the second part of axillary artery under cover of the pectoralis minor and supplying the mammary gland and thorax region also. Then what about the third part of the axillary artery giving three branches? Third part of axillary artery giving three branches are two going around the humerus bone, surgical neck of humerus bone. So what are the name? Anterior and posterior. What is anterior, posterior? Anterior and posterior circumflex humeral artery, because they are going around the humerus. Anterior circumflex humeral artery, posterior circumflex humeral artery. What are they doing? They are anastomose on the surgical neck of the humerus. And what is the third branch of the third part of the axillary artery? It is going under the scapula, so it is called subscapular artery, and it is the third branch from the third part of the axillary artery. It is participating in scapular anastomosis. Then you are telling all these arteries, maybe the internal thoracic artery, or maybe the superior thoracic artery, maybe the acromiothoracic, or the lateral thoracic, or the subscapular, all of them are going to mammary gland. So they supply the mammary gland. Mammary gland is a highly vascular structure. All thoracic supplying, namely internal thoracic, maybe superior thoracic, maybe acromiothoracic, or maybe lateral thoracic, and even the subscapular artery. It is also supplied by pica branches of the descending thoracic aorta. Here you will have the descending thoracic aorta and descending thoracic aorta giving the pica branches, which are posterior intercostal arteries. Posterior intercostal arteries come and supply the mammary gland, branches of the descending thoracic aorta. Okay, then what is this axillary artery doing after crossing the lower body of teres major? See, axillary artery is starting at the outer body of first rib, reach the lower body of teres major, and then continue as the brachial artery. And the brachial artery, which is running the arm, is a content of the cubital fossa. Let us magnify the region of cubital fossa then, and there you see. As you magnify the region, you will find that this brachial artery is coming to the cubital fossa and dividing into two branches. One follow the radius bone, radial artery, other following the ulnar bone, the ulnar artery. So you want to say there are three arteries in the cubital fossa? Yes, they are brachial artery giving two branches, which are radial and ulnar artery. So three branches in the cubital fossa. And what is radial artery, ulnar artery doing in the palm? You see, what is the ulnar artery doing is forming social palmar arch in the palm, and the radial artery will form the deep palmar arch. So I think these arches have some multiple communication. Yes, they have multiple communication, and you can check that communication anastomosis by doing Allen test. Allen test is done to check the communication between deep palmar arch and the superficial palmar arch. And how do we do the Allen test? And why do we do the Allen test? You are doing the Allen test before taking the radial artery blood sampling. Why? Because when you take the radial artery blood sample, there is a chance that radial artery might develop thrombus and the thumb will die of ischemia. There is a chance. So you are telling that before taking radial artery blood sample, I have to do the Allen test? Yes, because radial artery blood sample, you might have thrombus in the radial artery leading to thumb ischemia. No, it will not happen. Why it will not happen? Because this time it is an emergency. In emergency, ulnar artery is patent enough to supply the radial artery territory, even if it was blocked by some thrombus. You mean to say, normally, radial artery supply the thumb? Yes, but in emergency, there is a radial artery thrombus. That time, ulnar artery is patent enough to supply the thumb. Yes, and there will be no ischemia? No. How do you know that? By doing Allen test. Yeah, how do you do Allen test? You see, to do the Allen test, I have to block both the arteries, and the patient has already made a fist there. So what are you blocking? I'm blocking radial artery as well as ulnar artery. I have told my patient to make a fist, and I see when he open the fist, there will be pale hand. Why pale hand? Because I have blocked both the arteries. So you have blocked the radial artery, ulnar artery both. Yes. And that's why you are seeing some pallor in the hand. Yes. Now what I do is I will release. What are you releasing? I'll release the ulnar artery. I want to check the patency of ulnar artery. Is it capable of supplying? I want to check the patency of ulnar artery. Is it capable of supplying the social palmar arch and also deep palmar arch and also the thumb region? Because I am expecting that when I take the radial artery blood sample, there might be a thrombosis in the radial artery, which can lead to thumb ischemia. I want to make sure that it does not happen. You mean to say Allen test is done to check the anastomosis between the social deep palmar arch? Yes, also to check the patency of ulnar artery. Allen test is done to check the patency of ulnar artery. Is it capable of supplying the thumb region or not in case of radial artery thrombosis? This is called as Allen test. Okay. What is this? This is about the two arteries which you have just seen. We want to see some branches, and it is the radial artery which is forming the deep palmar arch. And what is the ulnar artery forming? If you say ulnar artery, then this is the ulnar artery on the ulnar side, little finger side, and forming social palmar arch. And they have some multiple anastomosis. Yes, they do have multiple anastomosis, but see, ulnar artery, like ulnar nerve, is supplying 3.5 fingers Ulnar artery, like ulnar nerve, is supplying this major portion of the hand basically. So ulnar artery, like ulnar nerve, is supplying major portion of the hand, the skin. No, not the, see here what you are looking at is ulnar artery supplying 3.5 fingers, the skin and the fingers deeper inside also. So you're telling that ulnar artery is taking care of 3.5 fingers, skin and the deeper aspect also? Yes. But if you are talking about the radial artery, it is giving us princeps pollicis artery for the pollex, the thumb, and also giving the radialis indicis artery. What is radialis indicis? It is actually 1.5 fingers supplied by the radial artery, and it is the thumb, lateral medial side, and also lateral side of the index finger. So lateral side of index finger, yes, and lateral side and medial side of the thumb, yes. This is all by the radial artery, yes. What about the other 3.5 fingers? That is ulnar artery territory. So you're telling that radial artery supply 1.5 finger skin and the deeper aspect, yes, by giving some princeps pollicis, which is for the both aspect of the thumb, lateral medial, and then this is radialis indicis, which is on the radial side of the index finger, radial side of index finger, because ulnar side is by ulnar artery. And these arches have multiple communications. Let us draw this diagram of upper limb artery briefly now. As you see, we have got the subclavian artery under the clavicle, crossing the outer border of the first rib. It will enter the axilla and become the axillary artery, and then crosses the lower border of teres major to become brachial artery. So here it is the axillary artery. Yes, that is axillary. And there it is the brachial artery. Yes, that is where it is brachial artery. The extent of the axillary artery is from the outer border of first rib to the lower border of teres major and is covered by a muscle. That muscle is called as the scalenus. It is called as the pectoralis minor muscle. So this is the pectoralis minor muscle, which is dividing the artery into 3 parts. Yes, they are the first part of artery, second part of the artery, and third part of the artery. First part is proximal to the muscle, second part deep to the muscle, and third part distal to the muscle. And then what is the brachial artery doing? Brachial artery will enter the cubital fossa, and in the cubital fossa it will give 2 branches. One is following the ulnar bone, it is called ulnar artery, and then it is the other one following the radial bone, and it is called radial artery. This radial artery will be forming the deep palmar arch in the palm, and the ulnar artery is forming the superficial palmar arch, and these arches have multiple anastomosis. If you want to check that anastomosis between the 2 arches, then you can do Allen test, and Allen test is also done to check the patency of the ulnar artery, whether the ulnar artery is capable enough to anastomose the social palmar arch, deep palmar arch, and also supply the thumb in case of an emergency. What is the emergency? That I have taken a sample in the radial artery. There was a thrombus, and there is a chance that thumb might have ischemia. I want to make sure thumb do not get ischemia if there is a radial artery thrombus. So how do you do that? I do the Allen test, because Allen test will tell me about the patency of ulnar artery, which is still capable of having anastomosis there and supplying the thumb in case of emergency, which could be block in the radial artery. So you told that these 3 arteries are content of the cubital fossa. Yes, the 3 arteries are content of the cubital fossa there. But then we have to talk about 6 branches of the axillary artery. You have seen there is the first branch given by the first part of the axillary artery called superior thoracic artery, which is supplying the mammary gland but not the scapular anastomosis. Then you can tell that there are 2 branches under cover of the pectoralis minor muscle. One of them is called as the acromiothoracic artery, and the other thoracic artery is called as the lateral thoracic artery. Now maybe it is acromiothoracic or lateral thoracic artery. Both of them are going to supply mammary glands. And what is the third part doing? Third part will give you three branches, one going anterior to humerus, other posterior to humerus, one is under the scapula. So the one which is under the scapula supply the mammary gland, and the scapular anastomosis is called as subscapular artery because it is under the scapula. And what about the other two which are going around the bone humerus? The arteries which go around the bone humerus there, anteriorly you will have the anterior circumflex humeral artery, and posteriorly you have the posterior circumflex humeral artery. If you remember, the posterior circumflex humeral artery, which is a branch of the third part of the axillary artery, will be passing through the quadrangular space along with the axillary nerve to come to the surgical neck of humerus, because at the surgical neck of humerus it is anastomosing with anterior counterpart. So anterior posterior circumflex humeral artery make anastomosis on the surgical neck of the humerus. Now we are going to talk more about the scapular anastomosis. As you are talking about the scapular anastomosis, we require it because I got a patient with the subclavian artery block. And why there's a block? Because there was a cervical rib compressing the artery. So there's a cervical rib compressing subclavian artery leading to upper limb ischemia. Yes, leading to upper limb ischemia. Now tell me, how will I supply the ischemia zone? You have to use this anastomosis. Which one? Scapular anastomosis. So what is the question asking? It is asking who is not participating in scapular anastomosis. It is supposed to supply the upper limb now. And you already know the answer, because this is the first branch of the axillary artery supplying the mammary gland, but not the scapular anastomosis. You mean to say subscapular is contributing? Yes. And suprascapular, thoracocervical tongue. How these arteries are contributing to scapular anastomosis, then explain. If you say the answer is choice number D, fine. You see, we are talking about scapular anastomosis. Let us look at that on the dorsal view of right scapula. So, dorsal view of right scapula, that is where you will show some artery. Yes, what I am telling you is, we are going to follow right-sided subclavian artery in the neck region. Right-sided subclavian artery in the neck region. As it crosses the outer border of first rib, enter the axilla and become the axillary artery. Some branches of the axillary artery anastomose with the branches of the subclavian artery. And this is called as scapular anastomosis. And why do you need scapular anastomosis? Maybe there's a block in the subclavian artery. Why there's a block in the subclavian artery? Due to cervical rib. This is the discussion. So you're telling that if there's a block in the subclavian artery leading to upper limb ischemia, you want to supply this upper limb zone? Yes. And you can bypass the block by scapular anastomosis. You can send the blood from the proximal artery, which has a lot of blood at high pressure, because there's a block here. Since there's a block here, the proximal area will have a lot of blood at high pressure. You can shunt it through the scapular anastomosis or distal part of the arterial tree and supply the ischemia zone. This is the discussion. Now see, as you look at the dorsal view of the right scapula, you will find this is the subclavian artery under the clavicle. And what is it doing? It is crossing the outer border of the first rib to enter the axilla, and when it will enter the axilla, it is called as the axillary artery. Now this axillary artery is giving some branch which is going under the scapula. The one which is going under the scapula is called as the subscapular artery and continues further as the thoracodorsal artery, because it is going dorsal to the thorax. So you are telling that this is the third part of axillary artery. Yes, it is third part of axillary artery giving the subscapular artery under the scapula, which will then continue as the thoracodorsal artery. And subscapular artery gave a branch around the scapula, and that branch which is going around the scapula is called as the circumflex scapular artery. What about the branches of the subclavian? Branches of subclavian, you can see it is giving some thyrocervical trunk, and the thyrocervical trunk is giving the sit branches. In the sit branches, you have the suprascapular artery coming superior to scapula, and that is going to anastomose with the circumflex scapular artery, making scapular anastomosis. So you are telling thyrocervical trunk here. Yes, thyrocervical trunk is giving the sit branches. In the sit branches, S is the suprascapular artery coming superior to scapula and anastomosing with the circumflex scapular artery and continue supplying the distal artery tree. And what is the other artery participating for scapular anastomosis? You will see that this thyrocervical trunk gave a branch. Thyrocervical trunk is giving a branch which is called as the dorsal scapular artery, dorsal to the scapula, and it is anastomosing with the thoracodorsal artery. Actually, thoracodorsal artery is also called as the continuation of subscapular artery. In fact, some books will say it is the subscapular artery which is anastomosing with the dorsal scapular artery, participating in scapular anastomosis. So there are two anastomoses which we have to discuss. One is the subscapular artery and the dorsal scapular artery, and the other is suprascapular artery and the circumflex scapular artery. Why do you want to know that? Because I had a case which is a block here, where in the subclavian artery. So subclavian artery blocked, yes, leading to upper limb ischemia, yes. And if there is a subclavian artery block here, upper limb ischemia, then I need some alternate collateral channels to continue supply here. This is the diagram which we are supposed to draw now, same diagram. As you draw the diagram, you are looking at the dorsal view of the right scapula. And if you say this is the dorsal view of right scapula, you are also looking at the dorsal view of the right subclavian artery. Now, if you say this is the right subclavian artery and you are looking at the dorsal view, you mean to say it is now in the neck region? Yes, it was running in the neck region. So this is the dorsal view of the right subclavian artery running in the neck region. Then what is it doing? What it is doing, it will reach the outer border of the first rib, and at the outer border of the first rib, it will enter the axilla. As it will enter the axilla, it will become axillary artery, and then its axillary artery is going to supply the upper limb region. So this is the right subclavian artery seen from the dorsal view in the neck region. Yes, it was running under the clavicle in the neck region, crosses the outer border of the first rib to enter the axilla, become the axillary artery, and then supplying the upper limb. Now there's a problem. What is the problem? Problem is that I have a cervical rib here, and because of the cervical rib, there is a compression of the subclavian artery leading to upper limb ischemia. How will I supply the ischemia zone now? Because I have a case of cervical rib which is compressing the subclavian artery now and leading to upper limb ischemia. You have to use the scapular anastomosis. And what is that? You look at the third part of the axillary artery now, giving one artery under the scapula which is called subscapular artery. So this is the subscapular artery branch from the third part of the axillary artery. Yes, third part. So now we are looking at the third part of the axillary artery, giving some artery under the scapula which is called subscapular artery. Yes. And this subscapular artery further continue as the thoracodorsal artery, because it is going dorsal to the thorax there. And this subscapular artery gave a branch. The branch which it is giving is going around the scapula, so it is called circumflex scapular artery. So you are telling that now this subscapular artery giving a branch around the scapula which is called circumflex scapular artery. Yes. It is participating in scapular anastomosis along with subscapular artery there. So what is the other arteries participating? Actually, if you remember, the subclavian artery was divided into three parts by some muscle which is called as the scalenus anterior muscle in the neck region. And the first part was giving the width branches. Tell me, what are the width branches of the first part of the subclavian artery? What is this V going up? The V which is going up is the vertebral artery, which is going to supply the circle of Willis going upward. And what is this I coming down? This I coming down is the internal thoracic artery, which is going to supply the thorax and mammary gland on the thorax. And what is this T branch? The T branch is called as the thyrocervical trunk. So T branch is called as the thyrocervical trunk. Yes, itself is giving the sit branches. So in the bit the T will give sit branches, then what is this T giving sit branches? What is this S for? You will see that this is the thyrocervical trunk which is giving 3 branches. Yeah, so what are the 3 branches then? They are called as the SIT branches. Yeah, SIT branches, but what is S for? You see, this is the first part of the subclavian artery. It gave the wit branches. In the wit branches, this is the thyrocervical trunk, and it is giving the sit branches. In the sit branches, the S is suprascapular artery coming superior to scapula. So this is the suprascapular artery coming superior to scapula to participate in the scapular anastomosis now. Yes, you can see. If there is a cervical rift, then there is lot of blood proximal to this block and at high pressure. That blood which is at high pressure is pushed into the thyrocervical trunk, pushed into the suprascapular artery, pushed into the circumflex scapular artery. There is an anastomosis, and this blood from the circumflex scapular artery now will come to the subscapular artery and supply the axillary artery and the ischemia zone. That is a blood flow. I can mark the blood flow now. So you are telling that there is some blood flow marking now. Yes, see, blood is coming into thyrocervical trunk, into the suprascapular artery, and from the suprascapular into the circumflex scapular artery, and from circumflex scapular into the subscapular artery, and into the axillary artery to supply the upper limb ischemia zone, because there was a block here in the subclavian artery. So you're bypassing the block. You don't have blood distal to this, but you definitely have a lot of blood proximal to this. That blood you will shunt this way towards this anastomosis, which is suprascapular circumflex scapular anastomosis. This is one. Now if you say this is one of the anastomosis, then what is the other one? Other one, let me tell you. Actually, it is a third part of the subclavian artery giving the dorsal scapular artery. So third part of the subclavian artery will give the dorsal scapular artery. Yes, usually, but sometimes it can also be given by, sometimes it is also given by the this is the thyrocervical trunk giving the transverse cervical artery, giving the dorsal scapular artery. This is rare. So you are telling, normally this dorsal scapular artery, which is dorsal to the scapula, is coming from the third part of the subclavian artery. Yes, coming from third part of the subclavian artery, but as a variation, rarely it may come from the transverse cervical artery. Itself is a branch of the thyrocervical trunk from the first part of subclavian artery. So first part of subclavian artery will give the thyrocervical trunk, will give the transverse cervical artery, will give the dorsal scapular artery, rarely. Yes. Otherwise, dorsal scapular artery is a branch of the third part of the subclavian artery. Yes. And that is where you have anastomosis. You are telling this is some anastomosis now here. Yes. What is the use of this anastomosis? See, you got a block here in the subclavian artery, isn't it? Yes. You have no blood there distally. No, that is why there is upper limb ischemia. Yes, that is there. But I want to supply this region. How do you do that? What you do is, do you have enough blood in this segment of the artery? This is the block. Maybe that is a block. Distally you don't have blood, but proximally do you have blood or not? Yeah, proximally I have a lot of blood, and it is a high pressure. Use that high pressure and send the blood into dorsal scapular artery. And as the blood will come into dorsal scapular artery, anastomosing with the circumflex scapular artery, and from there it will go into the axillary artery. Continue supplying the upper limb ischemia zone. So you're telling there's a block here. Yes. And third part of subclavian artery, sending blood to dorsal scapular artery, and anastomosing with subscapular artery and sending blood to axillary artery to supply ischemia zone. Yes, that is the point. And sometime it may happen that It is the first part of the subclavian artery sending blood into the thyrocervical trunk, into the transverse cervical artery, into the dorsal scapular artery, and then dorsal scapular artery anastomosing with the subscapular artery and supplying the axillary artery, upper limb ischemia zone. But that is rare. This communication is rare. Then what is more usual? What is more usual is third part of subclavian artery anastomosing with third part of axillary artery. So third part of axillary artery giving some branches to anastomose with the branches of the third part of the subclavian artery. Yes, third and third. Though it can also be 1 and third. First and third. First part of subclavian and third part of axillary artery. Now we got one question. It is asking us, which branch of subclavian is contributing to scapular anastomosis? And when somebody say that, you should be giving the name of a direct branch if possible. So who is the direct branch of subclavian artery participating in scapular anastomosis? It is dorsal scapular artery, which is coming directly from the third part of the subclavian artery. Though sometimes it may come from the first part also, but usually from the third subclavian. So you're telling dorsal scapular is the answer. Yes. What if I remove that? If you remove that, then I will take my answer as thyrocervical. Why? Because I have learned that thyrocervical trunk is giving us suprascapular artery, and suprascapular artery is participating in scapular anastomosis. And sometimes we also have seen that thyrocervical trunk is giving us the transverse cervical artery, and the transverse cervical artery is giving us the dorsal scapular artery, and then the dorsal scapular artery is participating in scapular anastomosis. But this is an indirect course. If you say like that, it is indirect course. So my point is that of course C can also be the answer because it is also participating in the scapular anastomosis indirectly, but still D is better than C. Why D is better than C? Because D is a direct branch from the third part of the subclavian artery usually. And what about the C? C is not participating in scapular anastomosis directly. It will first give, thyrocervical trunk will give you the suprascapular artery and then it will participate. Similarly, the thyrocervical trunk itself will give you transverse cervical artery, which will then give you dorsal scapular artery, which will then participate. So it is indirect branches. Dorsal scapular artery is actually a direct branch of third subclavian, so this is a better answer. D is better than C.